Hey everyone, welcome back to the NPTE podcast. This is Will Crane, your host. Thank you so much for joining me as we go through the content you need in order to dominate on test day. So today we're talking through the genitourinary interventions or genitourinary system interventions. This is a smaller part of the test. We'll be talking through a practice question. This represents through the 2023 outline. This will represent somewhere between 4 and 7 questions, just a handful of questions on exam day. But before I get to the practice question, just a quick reminder, we have our crash course ongoing. So if you're looking for a quick way to go through the big systems of cardio, musculo, and neuro, right before test day, we run a crash course 3 weeks before every test day. We go through a multitude of practice questions together, as well as a bunch of pre-recorded material to help you get through those big systems and really just rock it on test day. If you have a group of 5 or more from your cohort, you want to get together, there's a pretty sweet discount for that. So be sure to check that out. You can email us over at ptfinalexam.com/contact to get in touch with us with your cohort discount. Also of note, just a quick, this is a little preview announcement. In November, we're running a special event, much like what we did earlier this summer, where we will have an on-site NPTE review. It will be totally free to you. You just have to get to Chicago. We'll have more details about that forthcoming, but that'll be in November. Be sure to check that out. You can find out all the information and register at ptfinalexam.com/podcast. Sign up for the email list and you'll get instructions on how to register for that free event. If you like to learn in person, if you like to be able to go over the content, ask questions, I think you'll get a real kick out of this one. Again, be sure to check that out, ptfinalexam.com/podcast, where you'll find the form as well as be able to sign up and get in contact with us for that on-site review. All right, so to our question today. So this is the genitourinary system. Let's go ahead and dive into our question. As per usual, I'll read you the question, give you a moment to respond, and then we'll talk about it together. A pregnant patient is being evaluated for low back pain and pelvic girdle pain. The patient was placed briefly in supine positioning and has now risen to a standing position. Immediately after rising, the patient describes the presence of significant dizziness, fatigue, and faintness that was not present at rest. Which of the following interventions would be most appropriate to perform first? So we've got a pregnant patient being evaluated for low back pain and pelvic girdle pain. The patient was placed briefly in supine positioning and has now risen to a standing position. Immediately after rising, the patient describes the presence of significant dizziness, fatigue, and faintness that was not present at rest. Which of the following interventions would be most appropriate to perform first? 1. Instruct the patient to avoid static standing postures and perform ankle pumps frequently while standing. 2. Discontinue the evaluation and contact the physician immediately. 3. Return the patient to supine with legs elevated until symptoms subside. 4. Fit the patient with elastic compression stockings on bilateral lower extremities. So again, our answer options are: instruct the patient to avoid static standing postures and perform ankle pumps frequently while standing. 2. Discontinue the evaluation and contact the physician immediately. 3. Return the patient to supine with legs elevated until symptoms subside. And 4. Fit the patient with elastic compression stockings on bilateral lower extremities. So this question is describing, so we have a pregnant patient, perhaps that's the little outlying feature here, but this person has essentially gone from supine to standing and describes the presence of significant dizziness, fatigue, and faintness that was not present at rest. So all things considered, when you have faintness, fatigue, and dizziness that occurs immediately after going from a seated or supine position up to a standing position, these are the classic signs of orthostatic hypotension. Of note, pregnant patients, so pregnant women, are much more likely to experience orthostatic hypotension, and this is primarily because of the increased cardiovascular demands that are a result of pregnancy. So to actually describe the I guess you'd say the signs associated with orthostatic hypotension would be a drop in systolic blood pressure of 20 millimeters of mercury, or a drop in diastolic and systolic of 10 millimeters of mercury or more. So if you have a change of 10 in diastolic or a change of 20 of systolic, that would be a clear indicator of orthostatic hypotension. Now, of note, pregnant patients are particularly susceptible to this, and so you should always be carefully monitoring them for it. So as far as ways to prevent it, You could involve educating the patient on avoiding static standing postures, performing ankle pumps frequently, especially while standing. That would clearly be a good preventative measure. You could also have compression stockings. Again, that would affect venous return. And so if you wanted to, let's say you had a patient with particularly bad orthostatic hypotension, they may require compression stockings to prevent that hypotension from occurring. But the immediate or first response should be to get the patient into a Trendelenburg position, or at least a feet elevated position, in order to get the symptoms to subside. So the real key here is that they have diminished blood flow to their brain. And so therefore, the best way to remedy that is to put them in a, what's called, you'd have the either Trendelenburg position. True Trendelenburg is to have the feet higher than the heart, but you could, well, I guess to put the whole body upside down, essentially head lower than the feet. But the modified Trendelenburg, much more, I guess you could say, much more common. You have them supine, but then you place something underneath their feet so that their feet are elevated above the level of the heart, so as to return blood back to their brain. So some of you are probably asking yourself now, Will, is it not true that with pregnancy, it is advisable to avoid the supine position? The caveat is yes, but there is a little asterisk there. You can achieve the supine position with modification. You place pillows under the right hip, place them in a pseudo left side lying position, but it is still technically supine. So even if you prop up the pillows under the hip, you are still in technically a supine position. And the other thing of note is that this person is about to faint and lose consciousness. And so first priority, restore blood flow to the brain. Second priority would be to maintain an adequate supine positioning. And I would argue you could do both at the same time. But the first thing you do is you get the symptoms to subside, and then you begin again by trying to get the patient to sit up and then maybe stand up again. If it continued or persisted at that point, you would discontinue and contact the physician directly, just because if the symptoms are severe and prolonged, you're going to want to get medical intervention very quickly. In this case, though, we don't have anything to indicate that. First step is to return the blood to the brain by putting them in the Trendelenburg position, or at least a modified Trendelenburg, with the feet higher than the head. Again, it is of note that you would not want to put the patient in supine for very long. In fact, Goodman describes you want to avoid prolonged supine with pregnant patients. That being said, a brief supine or a supine in order to get the blood back to the brain, that would be advisable. And then if they were going to be there for a prolonged time, you'd want to add the pillows or the bolster under the right hip to get the fetus to offload the inferior vena cava. But again, point being here, we need to get the symptoms to subside first. And then after that, then you start into education and applying compression stockings. But the very first and foremost thing you're going to do is to get the patient into supine, legs elevated until symptoms subside. So that would be the modified Trendelenburg position. Good. So there's a genitourinary question for you, asking about what you would do in the case of orthostatic hypotension, which is very common in patients with pregnancy, in pregnant women. The interesting thing is that kind of opposite of this is what's called preeclampsia or eclampsia, which is pregnancy-related hypertension. So in that case, you'd have the rushing headache, very similar to, I guess you could say, like an autonomic dysreflexia headache. Lots of a severe increase in blood pressure, but that's what's called eclampsia, or more likely preeclampsia, kind of that rising blood pressure. In this case, we're describing something that would be more along the lines of hypotension or orthostatic hypotension due to the change in position. So there you go. There's your practice question for today. Hey, just want to let you know, appreciate you. Appreciate what you're doing to get ready for this test. I know it's a long road. A lot of you are commuting on your way to clinical right now. There's a lot going on, and I want to be as helpful as possible. Be sure to check out ptfinalexam.com for all the courses we've got. We can help you get through the test. If you haven't yet, be sure to leave us a 5-star review over on Google Play, Apple iTunes, Spotify, wherever it is you're listening to this podcast. And in the meantime, stay safe. Have a happy study session, or happy studying, I guess. Will Crane fist bumps all around. I'll catch you in the next one. Thanks, everyone.